Hello, and thank you very much for joining me today for this GP CPCS training for general practice teams. My name is Alison Scowcroft and I'm a pharmacist here to talk to you about GP CPCS. The objectives of today's session are as follows. Hopefully by the end of watching this video you will be able to understand the GP referral pathway, particularly which patients can be referred, which team members in your practice can make those referrals, and also to understand the referral protocol and escalation processes that we've agreed across Greater Manchester. We'll also talk then about how to embed GP CPCS into your practice's usual ways of working, make sure you know when your practice is going live, and to understand how general practice and community pharmacy will work together to make GP CPCS a success. So I'll start with giving you an overview. So some background, the NHS CPCS, and that stands for Community Pharmacist Consultation Service. The NHS CPCS is a nationally commissioned and nationally funded advanced service that was launched in community pharmacies across England in October 2019. And the NHS CPCS service is where NHS 111 send electronic referrals to community pharmacies for patients who have a minor illness. Around the same time that service was launched in 2019, NHS England also set up a pilot, and this was a pilot to expand a referral pathway to general practice patients with a minor illness. NHS England evaluated the pilot and decided to expand the service to include referrals from general practice to community pharmacy from the 1st of November 2020. So GP CPCS, therefore, is a referral pathway that general practice teams can use to refer patients with a minor illness or a low acuity condition to a community pharmacist. A patient who is referred electronically through GP CPCS will have a consultation with the pharmacist in the consultation room, or it can be done remotely, and the pharmacist will clinically assess the patient. They can refer to the summary care record and also the nice clinical knowledge summaries as part of the consultation. So this is not a conversation over the counter, it's a clinical consultation with the pharmacist. And only patients who've been electronically referred either from general practice or from NHS 111 can be included in this service. We've got some statistics here for you, some evidence. So from the NHS 111 CPCS service, they're averaging around about 10,000 patients per week being referred across England. And in the first 9 months of that service, from October 2019, over 330,000 patients were referred. So these first two statistics are just showing to you that community pharmacy is well versed to be dealing with these types of conditions that you're going to refer. Indeed, community pharmacists have been dealing with patients with these types of symptoms for a long time. They're used to dealing with these kinds of problems. And indeed, a patient could walk into a pharmacy off the street with any of the types of symptoms that you're going to be referred. So community pharmacy is well placed to deal with the conditions that you will refer through the CPCS service. For GP CPCS, in that pilot that I mentioned earlier, 88% of patients who were referred had their concern resolved by the pharmacist. So broadly speaking, 9 out of 10 patients had their issue resolved by the pharmacist. NHS England have done some calculations and they reckon that around about 6% of appointments could be safely referred to community pharmacy. And if that full 6% of appointments was referred, that could result in savings of up to £20 million. But this service is not about saving money, it's about the patient having access to a professional clinical service from the pharmacist of their choice. It's about the patient seeing the right healthcare professional at the right time for their needs. In general practice, by referring patients who have minor illnesses or low acuity conditions, you're going to create capacity. So you're going to save GP appointments and be able to allocate those to patients who can only see the GP, those more complex patients. And for general practice and community pharmacy, it will allow you to build on and enhance those local relationships. For community pharmacy, it allows community pharmacy to demonstrate its place within the NHS to manage patients with minor illnesses and low acuity conditions. And ultimately, it results in the cost-effective use of NHS resources to support these patients with minor illnesses and to support the self-care agenda. So now we're going to go into a little bit more detail and take you through the referral pathway. So this is an overview of the process. The referral is sent electronically from the GP, from the general practice, to the pharmacy. We ask that you tell the patient to wait for contact from the pharmacy. The pharmacy will then contact the patient within 2 to 3 hours, and only if the patient does not receive any contact within 3 hours should they then phone the pharmacy themselves to follow up the referral. Any referrals that are sent by 2:30 p.m. will be picked up the same day, but any referrals sent after 2:30 p.m. might still be picked up the same day or could be picked up the next day. We're working with community pharmacies to ensure that the pharmacists use their professional judgment to assess if a patient does require more urgent support for referrals sent after 2:30 p.m. and particularly if the day following the referral is a non-working day. So for example, a referral sent at 3 o'clock on a Friday afternoon to a pharmacy that doesn't open over the weekend. So key messages for you from this slide: please ask the patient to wait for contact from the pharmacy, but do ask the patient that if they haven't heard anything from the pharmacy within 2 to 3 hours, that they should then phone the pharmacy to follow up the referral. So how do you identify which patients you can refer to the pharmacy for the CPCS service? So this process begins with general practice team, and we'd like you to consider this as part of your total triage process. So your patient will contact the practice either by phoning or through using some sort of online triage system that you may have within your practice. And it's the care navigator or the receptionist who receives that contact from the patient, who can then use their care navigation skills to ask the patient what their presenting symptoms are, and then assess the issue against a list of conditions which are suitable for referral under CPCS. So you can see on screen here we have the GM referral protocol. This is the red and green list. This is a really valuable and important document. You will receive a link to this document. I suggest that you print this off in colour if possible, have it stuck on the wall, have it on your desk, and anybody who receives calls from patients should really spend some time familiarising themselves with the conditions that are suitable for referral to pharmacists on the green side of the referral protocol, and also with which circumstances on the red side are not suitable for referral. So you can see on the green side there's lots and lots of symptoms that are suitable for referral. The service is suitable for patients aged 1 year and over. There is no upper age limit, but please do not send referrals for patients who are under the age of 1 year. On the right hand side you've got some red flag symptoms which are specific to each of the specific conditions in the referral protocol. So please make sure that you review that red side of the referral protocol and do not refer any patients to the pharmacist who have symptoms that are described on the red side. The pharmacist will not be able to help these patients. So make sure that your patient has symptoms that are in line with the green side of the referral protocol. Here in Greater Manchester, we've been live with GP CPCS now for almost a year. We started, our first referrals were sent in May 2021. So we've got lots and lots of data and information about the types of referrals that are being sent by your colleagues across Greater Manchester. It won't surprise you to know, I'm sure, that the top group of symptoms for GP CPCS referrals in Greater Manchester are colds, coughs, flu-like symptoms, nasal congestion and sore throat. That group of symptoms accounts for almost 1/5 of all referrals, with 4/5 of those referrals the patient having their issue resolved by the pharmacist. So a great group of symptoms to refer. There's lots of opportunities for the pharmacist to provide advice to support with these symptoms, and lots of options for products that are available over the counter to help. Another good type of symptom to refer is skin problems or rashes, accounting for about 6% of all referrals in Greater Manchester, with 3/4 of referrals for skin problems resolved by the pharmacist. Eye problems are a great set of symptoms again to refer, so itchy eyes, sticky eyes, runny eyes, watery eyes, accounting for about 5% of all referrals, with 82% resolved by the pharmacist. Diarrhea and constipation is another good group of symptoms to refer if the problem is acute in nature, so short-lived for the patient, accounting for about 3.5% of all referrals, with over 80% of referrals for diarrhea and constipation resolved by the pharmacist. And you can see there's lots of other symptoms on there, as was on the green side of the referral protocol on the previous slide, of symptoms that are suitable to be referred: allergic reactions, blisters, earwax, bites and stings, etc. There are some conditions that we wanted to pull out for you that just might require a little bit more care before you do decide that a patient is suitable to be referred to the pharmacy. All of these examples are based on feedback that we've received from general practices and community pharmacies who are live with GP CPCS referrals, and they are all included in the red side of the referral protocol. If you can, it's really helpful to always ask the patient how long they've had the symptoms for and have they tried any medicines over the counter. So, for example, if you have a female who has cystitis type symptoms or a potential urinary tract infection, if she's already tried the sachets that you can buy over the counter, then unfortunately there aren't any other treatment options available for the pharmacist, so don't refer in that case. If you've got a patient with pain in the ear or the eye, we can only treat this over the counter in community pharmacy with painkillers or analgesics. And eye pain in particular does suggest a more serious condition which may need the GP to assess, so do not refer. I mentioned on the last slide that conjunctivitis or eye problems are a really great set of symptoms to be referred under the CPCS service, and they absolutely are. Unfortunately, the over-the-counter antibiotic eye drops that you can use to treat bacterial conjunctivitis are not licensed for use in the age of under 2. Although for CPCS you can refer patients to age 1 and over. So if you do have a potential conjunctivitis, a bacterial conjunctivitis patient who is aged 1, please do not refer. If you have a patient who has discharge from the ear, and this is definitely not wax, it is discharge, that does suggest an ear infection, which again we can only treat in community pharmacy over the counter with painkillers or analgesics, so do not refer. And then finally, if you've got somebody with pain or swelling in the lower limb, this is included in the referral protocol, but unless this is related to an injury of some sort, a sprain or a trip or a fall, then actually those symptoms could suggest something a little bit more serious, potentially a DVT. So only refer pain or swelling in the lower limb if that is related to some sort of injury. And as I mentioned before, if you can ask the patient how long they've had their symptoms for, that will really help you to understand whether the symptoms that they're experiencing are acute or whether it is something more long lasting. Generally speaking, anything over 2 to 3 weeks is more problematic, but do check the referral protocol because on the red side it does clearly outline where the duration of symptoms starts to become more of a red flag concern that the GP would want to see. So once you've identified that your patient has some symptoms that are appropriate to be referred, then you're going to make that electronic referral. And in Greater Manchester, we've arranged for you to have access to an electronic referral tool, which depends upon which clinical system you use within your practice. So if your practice uses EMIS, which is the majority in Greater Manchester, then you're going to use a referral tool which is integrated into EMIS Web. This is called the Local Services Dashboard. It was previously called Patient Signposting or Patient Access Connect. Both of those things do exactly the same thing. It's just that EMIS has renamed the referral button. So you're looking for the Local Services Dashboard, and you can see a little picture of it there with a face with a green arrow on. If you're in a practice that uses Vision or System 1 as your clinical system, then unfortunately there isn't a tool that's integrated into either of those systems, but we do have for you a web-based referral tool which is called PharmRefer. And this is a separate system that you will log into, but it captures the same information as the EMIS tool and allows you to send the referral through to the pharmacy. Whichever of those two referral tools you use, you're going to have two options when you want to send a referral to the pharmacy. You can either create a referral or you can assess for referral. What happens at the pharmacy end is exactly the same, no matter which of these two buttons you press. The only difference is that if you press assess for referral, there are some additional triage questions in there, which will help to support you to identify an appropriate referral. So there's a couple of questions with drop-down boxes where you have to select the answer, and it's looking to weed out things like sepsis and COVID, for example. So you would answer those questions and then it will take you through to sending the referral. However, create for referral is a little bit quicker to fill in because it doesn't have those additional triage questions. So it's up to you as a practice which of these two buttons you press, either create a referral or assess for a referral. I'm now going to show you a couple of videos that demonstrate how the different tools works. So the first video that I'm going to show you is for EMIS practices, and then afterwards I will show you a video for Vision and System 1 practices.
Local services can be used for the NHS Community Pharmacist Consultation Service, CPCS, and allows GP staff to safely triage patients with minor illnesses and refer them to a local community pharmacist. The following demonstration will show how to use local services. From within EMIS Web, local services is launched from the EMIS Web ribbon. The user and patient details are brought through into local services, and the user can select a service from a list of referral services available to that organisation. In this example, I'm a GP receptionist who is speaking to a patient with a minor illness symptom such as acne or spots. Using the GP authored assessment template, the receptionist can quickly determine the best course of action for the patient. If the patient requires GP assessment, the receptionist will be advised how urgent this is. In this example, the receptionist is advised that the patient's symptoms need an immediate GP appointment. However, for the purposes of the demonstration, I will go back a step and follow a different path. For example, if the patient has significant scarring of the skin, the receptionist will be advised that the patient does need to see a GP, and this can be a later GP appointment. For the purposes of the demonstration, I'm going to go back a step. I will say that the patient has no further acne symptoms. If a GP appointment is not required, then the receptionist uses local services to refer the patient to a local community pharmacist. Additional information about the patient's symptoms, self-care and concerns can optionally be provided to the community pharmacist. Using the patient's postcode, which is brought through from EMIS Web, the user searches for a local community pharmacist user then completes a referral form, this referral form will be pre-populated with information taken from the patient's EMIS-Web record. Supplying a referral reason, the user then creates the referral. Once created, the referral is sent digitally to the community pharmacist, who will receive this within their farm outcomes system, and an email notification is also sent to the patient. And the SNOMED CT code is also added into an EMIS-Web consultation with details of the assessment and the referral. Turning to EMIS-Web, on refreshing the patient, you'll see that there is a consultation to the community pharmacist consultation service added. The name of the pharmacist is also displayed, and the reason for the referral is also indicated. There is an attached PDF that contains full details of the assessment template that was completed, and the referral is also coded using a SNOMED CT code. Returning to local services, you can see that there is also a report of all referrals and assessments made for that particular service. And as you can see, the referral I've just made is there at the top as the most recent referral. There is also within the report notification of any errors relating to the referrals made. And these are also indicated on the dashboard as well for the user to take action. This is the end of the demo. Thank you for watching.
Okay, and now the video for practices who use Vision or System 1, who will be using PharmRefer to make their referrals.
Welcome to the Farm Outcomes training video for PharmRefer and the Community Pharmacist Consultation Service. PharmRefer provides a simple and secure mechanism to allow referral of patients with minor illnesses from GP practices to community pharmacies. PharmRefer can be used on a desktop computer, tablet, laptop, or even a smartphone. The standalone PharmRefer service uses a minimal dataset with no patient details stored locally. Each practice will have a unique login. Because the application supports referral only and does not store any patient identifiable information, it will only require re-authentication after 8 hours. Once logged in, the user will arrive at the PharmRefer patient triage page. This triage tool has been created by Dr. Sarah Jarvis at EMIS Health and peer validated. It reflects current guidelines around the conditions included in this service. To make a referral without triage, you can click here to be taken straight to the referral page. A series of questions now follows to assess the patient's suitability for a referral under the Community Pharmacist Consultation Service. Patients under the age of 1 year are not eligible for referral, neither are patients suffering from more serious conditions or those displaying symptoms of COVID-19 infection. If at any point the triage tool determines that the patient is not suitable for referral, an information box appears with details of the appropriate course of action. If a CPCS referral is recommended, you can go to the referral page by clicking the Create Referral button. If a referral is recommended but the patient declines, click this button to record the outcome and exit PharmRefer. Click the blue Search for Patient in PDS button to find the patient details. You can search by entering the patient details in these fields, or switch to using NHS number as the search term by clicking here. If the patient details cannot be found using the PDS, you can enter patient details manually here. If the patient would like to receive a text message with details of their referral, enter their mobile number here. Search for the pharmacy to send the referral to in this field and select from the matches that appear. You can search by pharmacy name, address, postcode or ODS code. Information about the reason for referral should be entered here. Please do not include any patient identifiable details. Once all fields are populated, simply clicking the blue Refer button will send all information recorded to the selected community pharmacy. Referral messages are sent as secure NHS interoperability messages. If the patient has consented and provided a mobile phone number, a system-generated SMS text will be sent to their mobile when the referral is sent. This message identifies the patient as a CPCS patient and details the name of the pharmacy the referral has been sent to. If the patient has not provided a mobile phone number, you can use this button to print a confirmation letter. The PharmRefer dashboard shows the number of referrals made over a specified date range and the destination pharmacies. The full list of referrals is made available from the History tab. From the Support tab, you can send a test referral to a specific pharmacy without the need to transmit patient details. The referral sent by PharmRefer will arrive in the Services screen of Pharm Outcomes of the community pharmacy. The chosen pharmacy is notified of receipt of a referral into their Pharm Outcomes system in the following ways. The pharmacy will receive an email to inform them that a CPCS referral has been received. If the pharmacy has a Pharm Alarm device installed, it will start to flash blue. All incoming referrals appear at the top of the Services screen in the Outstanding Referrals section. The pharmacist will now see the patient details, telephone number if recorded, and the reason for referral. Referrals can be completed, accepted for later completion, or rejected if necessary. If the pharmacy has received a test referral, these actions are replaced with a single option to acknowledge the test. The pharmacy follow-up template adopts a structured approach to referral management. If the patient record has been PDS matched, the pharmacist will be able to access the summary care record from within the template with one click. SCR one-click requires a connected smart card with the appropriate role-based access code. The presenting complaint is recorded and linked to the appropriate NICE clinical knowledge summaries appear to support clinical decision-making. If the patient requires escalation to another service, information on the appropriate pathway appears. If not, a symptom check and any actions taken are recorded. The consultation outcome is then recorded, which may include appropriate advice given, the supply of a medicine by over-the-counter sale or under a local minor ailment service or PGD, or that the patient was referred or escalated to another service. When the record is saved, a notification is sent back to the referring GP surgery that includes the pharmacist's details, patient details, consultation details and full outcome, and any medicine supplied, if this applies.
Okay, so now you've seen how you can send a referral, whether you're in a practice that uses EMIS or a practice that uses Vision or System 1. So once you've sent that referral through, the pharmacy will then contact the patient within 2 to 3 hours, and the patient consultation will usually be completed within 12 hours, just depending upon the patient's circumstances. The patient should only contact the pharmacy themselves to follow up the referral if they've not had any contact from the pharmacy within that 3-hour period. The pharmacist will conduct a consultation with the patient. It can be done remotely over the telephone, or it can be done face-to-face, in which case it will be in the consultation room. The pharmacist will conduct a clinical assessment of the patient, looking at their presenting symptoms, any relevant medical history and any medication taken, which they can see using the summary care record. NICE clinical knowledge summaries are also referenced to support the consultation, which have lots of up-to-date evidence-based information about how to deal with lots of different types of minor illnesses. The NICE clinical knowledge summaries also includes information about specific red flags for each type of presenting symptom. Once the pharmacist has gathered all the information, they will then decide on the outcome of the consultation. They must always give safety netting advice to the patient. So if your symptoms do not improve or if they get worse, you must come back to see me or go to see your GP. The pharmacist will decide whether they can manage that patient in the pharmacy or if they need to be signposted or escalated elsewhere. And if they do need to be escalated, it will be the pharmacist who manages that escalation. As you saw in the video, the consultation notes are sent back to the referring general practice by NHS Mail as a PDF attached to NHS Mail. And we do check as part of the deployment process in Greater Manchester that those notifications are being sent through correctly. There's 6 possible outcomes from a GP CPCS consultation. It may be that the pharmacist feels the patient just needs some advice and some reassurance. This accounts for almost 1/3 of all referrals in Greater Manchester. So the advice can include the provision of written information or a recommendation to use products that the patient has at home. It may be that the patient is encouraged to purchase a medicine over the counter. We do often get questions about this, so what happens if a patient doesn't pay for their prescriptions? Feedback from the pilot did show that a pharmacist recommending a patient to buy a product over the counter was not a barrier for patients, even in deprived areas. This does support the self-care agenda and also the GPCPCS commissioning statement, which was released a couple of years ago in 2019, where general practice is recommended not to prescribe products that are available to be purchased over the counter. It may be that the pharmacist is able to treat the patient with a local minor ailment scheme, and that's where there is a scheme commissioned and where the patient's presenting symptoms and the patient themselves are included in the eligibility criteria. At the time of recording this video, which is April 2022, there are currently minor ailments services commissioned in 8 out of the 10 Greater Manchester localities. Unfortunately, there is no minor ailments service currently commissioned in Bolton or Oldham, but pharmacies in each of the other 8 localities do have a minor ailments service commissioned. So if the patient themselves and their presenting symptoms are eligible for that locally commissioned service, then that could be a possible outcome for the GP CPCS consultation. It may be that the pharmacist feels that the patient requires some non-urgent signposting to another service, for example, an optometrist, or back to the GP for a routine appointment. An example of this may be a patient with a skin problem, which they've previously been able to treat with an over-the-counter steroid cream, but that's no longer effective. So that would be a request for a routine appointment to the GP, so a non-urgent escalation. It may be that the pharmacist considers that actually the patient should be seen by their GP the same day. And in this case, the pharmacist will contact the practice themselves to request that urgent same-day GP appointment. This usually happens because the patient has disclosed some information that the pharmacist feels is a red flag associated with the symptoms that they have presented with. And finally, in a minority of cases, the pharmacist may feel that the patient requires some more urgent escalation, either signposted to A&E or calling 999. Just to go through those escalation processes in a little bit more detail for you. So if the pharmacist identifies a patient requiring a non-urgent GP appointment during a CPCS consultation, they will contact the practice to arrange that appointment. We've been collecting information from practices as part of our deployment about how they want to be communicated to for their non-urgent and urgent escalations. And in a lot of cases, practices have provided us with an email address for non-urgent escalations. So the pharmacist will send an email to the email address that you have provided to us to request a non-urgent or routine appointment for that patient. The pharmacist will not set any patient expectations of any specific treatment or outcome. They'll make sure the consultation notes are sent through to the GP, and then it's up to the practice to allocate an appointment to that patient. If a patient does contact a practice directly to request an appointment following a referral, then we request that you do not deem this as an urgent appointment request by the practice. If a patient needs an urgent appointment, then the pharmacist will follow the urgent escalation process and make that contact themselves. So in that case, the pharmacist will make a telephone call to the surgery, to the practice, to arrange that urgent same-day appointment. Hopefully you've been able to provide us with a telephone number that allows the pharmacist access to the practice. Some practices have bypass numbers or back office telephone numbers. So if that's the number you've supplied, that's really helpful. So it means the pharmacist is able to get through with that urgent appointment request. As before, the pharmacist will not set any patient expectations of any specific treatment or outcome, and they will make the consultation notes available to the GP. And then it's up to the practice to allocate an urgent same-day appointment to the patient and to confirm that information to the patient themselves. If it's out of hours, there are a couple of options for the pharmacist. So they can use the NHS 111 healthcare professionals line. This is a clinical service that provides advice. It may result in an onward referral or support to resolve the issue, and that results in a routine post-event notification to the GP. If it's out of hours, as I mentioned before, then the pharmacist options are to refer the patient to A&E or call 999, in which case a report will be shared with the GP and the NHS England area team on the same day or as soon as possible the following day. So hopefully now you've got a really good understanding of which patients can be referred to the pharmacist under the GP CPCS service, how you're going to make that referral using the referral tool in EMIS or PharmRefer, and you should have a good understanding of what will happen to the patient once that referral has been sent through. So now I'm going to show you another short video which hopefully just brings everything together for you and reinforces some of the messages that you may find beneficial when talking to patients about the referral pathway.
We have now looked at how the service itself works, and I hope that you feel confident that your patients will be cared for in the same manner that they would be if they saw a medical practitioner in your practice. I now want to look at how you are going to convince Mrs. Jones that being referred for a consultation with a community pharmacist is the most appropriate action for the symptoms that she has contacted you about today. How you say it to Mrs. Jones is really important, as are the phrases and words you use. We will look at two different ways that you can say the same thing, and I want you to think about what you've heard on each occasion and how did it make you feel. Don't worry about writing any of these down, as they are on the resources page. Example 1. Mrs. Jones, I have listened to your symptoms today, and I suggest we send you to a community pharmacy. What do you think that Mrs. Jones heard and thought? The feedback from GP practice teams that I have trained includes the following. I'm being fobbed off. I want to see a GP. They're not taking me seriously. Alternatively, let's look at example 2. Mrs. Jones, having listened to your symptoms, I am sending you for a personal consultation today with an NHS community pharmacist. If you can just let me know which pharmacy you would like to go to, I can make the official referral now. What do you think Mrs. Jones heard and thought in this case? The feedback from the GP practice teams I have trained includes some of the following. They're taking me seriously. I'm going to have a personal consultation. I must be special. I can talk to someone today. It's an NHS service. That means it must be okay. So, by adding a couple of additional words, you have sent a completely different message. The GP practice teams I have trained were also clear that you don't ask Mrs. Jones whether or not she wants to go and see the pharmacist, hence the use of the word sending. Finally, a thought to leave you with. If you told Mrs. Jones that you were sending her for an X-ray at the local urgent care centre, it is highly unlikely that she would argue with you, as you are sending her to the most appropriate place to care for her condition. Sending Mrs. Jones to a community pharmacist for her minor illness follows exactly the same principles. That is, you are sending her to a medical expert who can appropriately care for her. However, we know that Mrs. Jones may still offer some reasons why she still needs to see a GP. Let's now look at some of those reasons and your potential answers to them. The list of these is also included on the resources page on the right-hand side of this screen, so that you can print it off and have it next to each of your colleagues as a reminder. When Mrs. Jones says, "If I go to the pharmacist, I won't get an appointment today," the answer is, "Mrs. Jones, if the pharmacist believes you need an urgent appointment, they will contact us." Mrs. Jones says, "I have been to the pharmacy already and they couldn't help." Mrs. Jones, did you have a personal consultation with the pharmacist where they went through the medicines you are on, etc.? The pharmacist won't know what to do. Mrs. Jones, pharmacists are highly trained professionals with 4 to 5 years training and spend a high percentage of their time helping patients with symptoms such as yours. I am not going to pay for anything as I get my prescriptions free. Mrs. Jones, the pharmacist will clinically assess you and will discuss the most appropriate actions to help you, which may or may not include a product. Finally, remember you are not going to persuade every patient with a minor illness to have a referral to the pharmacist. There will be some patients where you know it's not going to happen, and I'm sure you know who I mean. However, if you can move even 75% of your patients, you have just freed up more capacity for your practice. We have nearly come to the end of this training, and the final thing I want to cover is the following question you may have. Our practice is already very good at navigating / signposting patients to other services, including advising people to go to a pharmacy. Why do we need an electronic referral when we can just tell people to go? There are a number of reasons why it is better that you use this service and do an electronic referral. 1. By sending an electronic referral, you are ensuring that the patient is clinically assessed by the highly trained pharmacist. 2. The outcome of the consultation and any product supplied will be sent back to your practice, ensuring that your practitioners have the most up-to-date information and that you know the patient actually did attend a pharmacy and didn't just say they did. And 3. If the patient requires a referral back to the practice, this will be formally handled, therefore safely managing risk across primary care. And finally, 4. The pharmacist will get paid for the consultation, whereas if you already refer the patient, they won't.
Okay, so hopefully that video has pulled together some information for you and you're feeling a little bit more confident about how you're going to deal with these conversations with your patients. So now you understand the referral process and what to do, let's think about how we can fit this into your business as usual. So referring patients to community pharmacy through GP CPCS should be seen as one of the options a practice has when receiving an appointment request from a patient. It's not something extra that you have to remember. So whether your patient queries come into the practice on the phone or online, then GP CPCS will work as a potential outcome. So looking down the turquoise boxes going down the middle of the screen here, if the patient contacts the practice by phone to ask for an appointment, you can use your care navigation skills to ask the patient what their symptoms are and then assess those reported symptoms against the referral protocol in the middle of the screen there, the red and green list. If the patient's suitable for referral, then whilst you've got them on the phone, you can gain consent for the referral and confirm which pharmacy they want to be referred to. Then you fill in the referral tool using the local services dashboard in EMIS or PharmRefer. If the patient request for a GP appointment comes into the practice in a different way, so they send an email or they fill in some sort of online triage tool that you may have within your practice, then it will be the person in your practice who receives those online queries that will need to assess the patient's reported symptoms against the referral protocol. If the patient's suitable for referral to the pharmacist, then there are a couple of options. Some practices have the functionality where they are able to send messages back to the patient using the triage tool. If that's the case, you can send a message to the patient indicating that their query has been triaged and that they are most suitable to be referred to the community pharmacist. You can use some of the terminology that was in that video that we've just watched. If you add to that message to say that by replying to the message, the patient is consenting to the referral, and then ask the patient which pharmacy they wish to be referred to. Then when you get the message back from the patient, you can complete the referral. If your practice does not have that messaging out functionality, then what will happen is this will result in a phone call from the practice to the patient. You can then use the same terminology around the call being triaged and the patient being referred to the pharmacy, gain consent for the referral from the patient and confirm which pharmacy they want to be referred to, and then complete the referral tool. So hopefully that just shows you that GP CPCS will work for you no matter how you get your patient queries. So while we're deploying and implementing GP CPCS referral pathway all across Greater Manchester by a team of community pharmacy and general practice representatives, the success of the delivery of the referral pathway and the service on the ground and the patient experience does really rely on those local relationships between general practice teams and community pharmacy teams. We do strongly encourage you to talk to the pharmacies in your area about this service, to gauge their capacity for referrals before going live if possible, and to understand their current workplace pressures, what's going on in their pharmacy. We're encouraging pharmacists to make contact with practices too. So if you can open up those lines of communication with the pharmacies in your area, there's a couple of ideas of conversation openers here in the speech bubbles on the slide. So let's talk about patients who don't pay for their prescriptions, for example. You might want to ask the pharmacy in your area, do they deliver the minor ailments scheme? What are the restrictions around which patients can be treated under the minor ailments scheme, for example? So really encourage you to talk to the pharmacies in your area about this service, if possible before you go live, and certainly once you've gone live. So let's talk about the referrals from last week. Has there been any patient feedback, for example? We've had lots of feedback from practices and from community pharmacies who are currently using the GP CPCS service. We've got over 200 practices now live and referrals are being sent to 400 community pharmacies across Greater Manchester. So we've put together some suggested do's and don'ts for practices, which is based on feedback from those live practices. So for the do's, please do ensure that all practice staff who receive patient queries understand who can be referred and how to make a referral. As I just said, do talk to the pharmacies in your area to assess how many referrals per day or per week are acceptable, and make sure you refer patients to the pharmacy of their choice and that you gain consent from the patient for the referral. Use the appropriate tool to make all referrals and ask the patient to wait for contact from the pharmacy within 2 to 3 hours. Just consider the time the referral is sent and the opening time of the pharmacy. So if, for example, you're sending a referral through first thing at 8 o'clock in the morning to a pharmacy that doesn't open till 9, obviously the patient is not going to receive any contact before 9 o'clock. Remember to save the consultation notes in the patient's record when you get them back by email. And do keep in touch with the pharmacies in your area to update them on any changes which might impact on your referral numbers. In terms of the do nots, please don't refer patients with symptoms lasting longer than 2 to 3 weeks or anybody with symptoms in the red section of the referral protocol. Unfortunately, pharmacists are not going to be able to support any patients who do have symptoms in the red section of the referral protocol. Please don't refer patients who need an emergency supply of medication. That's not what this service is about. It's about minor illnesses. And please don't refer patients who you know may have issues with buying medicines over the counter. I mentioned before, please don't refer patients aged under 2 years with conjunctivitis, and don't refer patients for contraception, pill checks, or emergency hormonal contraception the morning after pill. Again, that's not what this service is about. Don't be inconsistent with making referrals if you can possibly help it. If you can refer consistently to regular pharmacies, it just helps those pharmacies to embed completing these consultations into their ways of working. Don't ask the patient to contact the pharmacy to follow up the referral unless 3 hours has passed. And don't refer a patient to their EPS nominated pharmacy as a default. Always check with the patient. In terms of next steps, you need to make sure you know when your practice is going live with GP CPCS. If you don't know, check with your colleagues within the practice. Excuse me. And I'll check with your GP CPCS lead as appropriate. Once that date's been agreed, then your lead will contact all the pharmacies in your area to let them know your go live date and to share with them that escalation information that you've provided to us. You can then start to make referrals to the pharmacy of the patient's choice from your go live date. Your GP CPCS lead is available to provide any support or answer any questions that you may have, and they will contact you after you've gone live just to check in and find out how you're getting on. We do have some post-deployment drop-in sessions available on Microsoft Teams. They're taking place weekly. So if you do have any questions or require any further support, you can attend one of those drop-in sessions. You can get the information for those drop-in sessions from your GP CPCS lead. So we're coming to the end of the video today. Hopefully we've answered all the questions that you've had as we've gone along through the session. If you do have any questions after watching this recorded session, then there are some resources on the next slide. There's some links on there. You can check those resources out. We've also got some frequently asked questions, which is linked into the slide here, and you'll get access to that afterwards. Otherwise, we do have some training question and answer sessions which are running weekly. So if you do have some questions for us before you go live, which haven't been answered by the video that you've just watched, then you can drop in to one of our training Q&A sessions. And if you get in touch with your GP CPCS lead for more information about those training Q&A sessions, it would be Louise for Bolton, myself, Alison, if you're in Oldham, Bury, Tameside or Wigan, and my colleague Ricky if you're in Hayward, Middleton and Rochdale, Salford, Stockport, Manchester or Trafford. There's some resources for you that I mentioned, and that brings the session for today to an end. Thank you very much.